Shock. It's a scary word, and for good reason. In simple terms, shock happens when your furry, feathered, or scaled friend's body isn't getting enough oxygen to its vital organs. Imagine a delivery truck hitting a major roadblock. That's what shock does to the body's supply chain. It's a life-threatening condition that needs immediate attention. Think of your pet's circulatory system as a network of highways. Blood, like delivery trucks, carries vital oxygen and nutrients throughout the body. Shock is like a massive traffic jam on these highways, preventing those essential supplies from reaching their destinations. Just like a traffic jam can cause serious problems in a city, shock can quickly damage organs and even be fatal if not treated promptly. Remember, time is of the essence when it comes to shock. The quicker we act, the better our chances of saving our beloved animals. So let's learn how to spot the warning signs and act fast. Shock can be caused by several culprits, each disrupting the body's delicate balance in different ways. Understanding these different types is crucial for accurate diagnosis and treatment. First up, we have hypovolemic shock. This happens when there's a significant loss of blood or fluids, like after a serious injury or severe dehydration. Imagine a water balloon suddenly springing a leak. That's hypovolemic shock, where the body loses its precious fluid volume. Next, we have cardiogenic shock, a real heartbreaker. It occurs when the heart, our hard-working pump, can't circulate blood effectively. This could be due to heart disease, heartworm disease, or other conditions that weaken the heart muscle. Imagine a pump struggling to push water through a hose. That's cardiogenic shock, where the heart struggles to do its job. Then there's distributive shock, a sneaky culprit that causes blood vessels to widen excessively. This widening, like opening too many floodgates, leads to a dangerous drop in blood pressure. Think of a garden hose suddenly losing its pressure. That's distributive shock, where blood flow becomes inefficient. Common causes include severe allergic reactions, anaphylaxis, and severe infections, sepsis. Finally, we have obstructive shock, a roadblock in the circulatory system. This occurs when something obstructs blood flow, such as a blood clot in the lungs or a buildup of fluid around the heart. Picture a clogged pipe preventing water flow. That's obstructive shock, where a blockage throws a wrench in the circulatory system. Each type of shock presents unique challenges, but they all share a common enemy: inadequate oxygen delivery to the body's tissues. Recognizing the specific type of shock is crucial for providing the right treatment and giving our animal companions the best chance of recovery. Our animal companions can't tell us when they're feeling unwell, so it's up to us to be vigilant and recognize the warning signs of shock. Early detection is key to successful treatment and can make all the difference in saving your pet's life. One of the most noticeable signs is pale gums. Healthy gums should be a vibrant pink. If you notice your pet's gums looking pale white or even bluish, it could indicate poor blood circulation and oxygen deprivation, a major red flag for shock. Another telltale sign is a rapid heart rate. When the body goes into shock, the heart races to compensate for the lack of oxygen, like a runner sprinting to the finish line. You might also notice your pet taking rapid, shallow breaths as their body desperately tries to take in more oxygen. Weakness and lethargy are also common signs. Just like we feel drained when we're unwell, animals experiencing shock often become weak and lethargic. They might have difficulty standing, walking, or even lifting their heads. Other signs to watch out for include cold extremities like ears, paws, and tail, decreased urine output, mental dullness or disorientation, and collapse. Remember, these signs can vary depending on the type and severity of shock. If you notice any of these warning signs in your pet, it's crucial to seek immediate veterinary attention. Don't wait for the symptoms to worsen. Time is of the essence. Section 4. Acting, fast diagnosis and first aid. Recognizing the signs of shock is only half the battle. Prompt action is crucial for improving your animal's chances of survival. While getting them to the vet immediately is paramount, there are a few things you can do to provide vital first aid. Firstly, keep calm and assess the situation. Is your pet conscious? Are they breathing? Check for any obvious injuries and control any bleeding with a clean cloth. If possible, take their temperature. A low body temperature can indicate shock. Next, carefully transport your pet to the nearest veterinary clinic or emergency animal hospital. If possible, call ahead and let them know you're on your way with a potential shock case. This allows the veterinary team to prepare for your arrival and provide immediate care. During transport, keep your pet warm and comfortable. Wrap them in a blanket and lay them on their side if possible. Avoid giving them anything to eat or drink, as this could worsen their condition. Remember, first aid is not a substitute for professional veterinary care. These steps are meant to buy you time and stabilize your pet's condition until they can receive proper medical attention. Section 5. Treatment and Prevention. Turning the tide. Upon arrival at the veterinary clinic, the team will swing into action, administering life-saving treatment tailored to your pet's specific type and severity of shock. The goal is to restore normal blood flow, oxygen levels, and organ function. Intravenous fluid therapy is a cornerstone of shock treatment. Just like replenishing a dehydrated athlete, fluids are crucial for restoring blood volume, improving circulation, and delivering essential nutrients to vital organs. The type and amount of fluids will depend on the underlying cause and severity of the shock. Medications may also be administered to address specific issues. For instance, if the shock is caused by an allergic reaction, antihistamines and corticosteroids can help reduce inflammation and open up the airways. If infection is suspected, broad-spectrum antibiotics will be given to combat the bacteria. In cases of cardiogenic shock, medications to support heart function and improve blood flow may be necessary. If a blockage is causing obstructive shock, emergency surgery might be required to remove the obstruction and restore normal blood flow. Prevention is always better than cure. While not all causes of shock are preventable, there are steps you can take to minimize the risks for your animal companions. Keep them up to date on vaccinations to prevent infectious diseases. Provide a safe and secure environment to reduce the risk of trauma and injury. And be prepared for emergencies by having a plan and knowing the location of the nearest emergency animal hospital. Understanding shock and knowing how to respond quickly can make all the difference in saving your pet's life. By being informed and prepared, you can become a true hero for your furry, feathered or scaled friend in their time of need.